Hello. I was a little bit confused about this assignment because I didn't know if we really need someone here to act like a patient, or we just have to pretend like we were having a patient here seeking our advice or my advice as a dermatologist about the skin cancer. Uh, in my case, I'm going to pretend there is someone here in my office. Her name is Nina, and I'm going to see Nina right now. So I'm going to talk to Nina about skin cancer. Um, let's see. Hello, Nina. My name is Christy. Um, I'm going to be your dermatologist today, right? Are you okay? Are you doing okay? Oh, great. Okay. After reading and reviewing your medical report and assessment, I just find out you just came to see us because of this facial sore is making you worried. It's not healing for several months. I'm going to be worried too, right? Okay, I understand, but that's okay. Um, I just look at it. I can see it. I can feel what is going on in your skin, but I'm not going to jump to any decision right now. I'm going to send you to the lab, and they're going to relay some tissue sample for the lab exam. After the result, we're going to find out what is going on. Just don't be worried, and we have to wait. Cross finger, everything will be okay. I'll see you in the next in an hour after the result, and we're going to talk about your result and trying to see what we can do to make this thing happen. I'll see you, okay? Just be safe and good, okay? Go to the lab. Thank you. I just talked to my patient, Nina. I sent her to the lab. I see her skin. She's developing skin cancer, and she wait for so long, several months. That is not okay, and that means she doesn't have all the information she needs to know about skin cancer. But I'm going to talk with her. I'm going to advise her, and I'm going to tell her all the treatment she needs after the result coming from the lab. In an hour, I'm going to see my Nina, my patient. Hey Nina, are you okay? You're gonna be waiting for an hour. I'm here and I have your result. Are you okay? Feeling good? Any pain in your soul? Any facial sore? Any pain or itching? I see itching. Okay, I see. But hey, we just have the result here, and um, after the lab exam, um, uh, the result is you have the skin cancer, but don't worry. Uh, Skin cancer is a disease, okay? And there is treatment for skin cancer. You just need to have the knowledge. You need to know, and you have to know what to do. What is the next step to take? Um, I'm going to tell you what is a skin cancer. It's a disease where in which tumor are developing are found in your epidermis. And there is two type of tumor of cancer. The first one is a basal cell cancer. The second one is chemo cell cancer. The third one is melanoma. That is developed on the pigment cell. The two first one are the most common cancer, skin cancer um, we have, most common people have. And don't worry, I'm going to explain to you and list some treatment. There is a lot of treatment for skin cancer, and I'm going to give you a couple of them, and I'm going to give you some this book, and there is all the details you need to know about skin cancer. You're going to review it and read, have more details about treatment. But a couple one I'm going to mention right now is what they call radiation. Radiation is where X-ray beams are directed to your tumor with no need of cutting or anesthesia. The second one, which we call cryosurgery, where the physician destroys the tumor tissue by freezing it with liquid nitrogen. The third one is photodynamic therapy, can be useful for growth on the face and scalp. These are three treatments I can mention to you. Um, and I'm going to give you the book because I said there is a lot. There is laser treatment, also there is a lot of them. I'm going to give you the book, but I'm just mentioning these three. I felt like you need to know about this. But before choosing any treatment, I will give you this information about skin cancer so you will know if something is wrong with your skin on time and to avoid any future exposure of skin cancer. Let me tell you uh, how to prevent skin cancer. Skin cancer, you need to you need everyday steps to sun safety. Avoid the sun as much as possible from 10 a.m. and 4 p.m. where the UV light is very strong. You have to seek the shade. You do not need to burn. Do not burn, okay? Apply sunscreen. You have to examine your skin from head to toe once every month. You have to do that. So to prevent, so you know if something is wrong on time. You don't have to wait for long and trying to find out what is wrong with me. So these are prevention. You need to look at it to avoid. You need sunglasses to avoid the sunlight, like the sunlight on your eyes. You need to avoid that. Apply sunscreen before going out. Who's, you may ask yourself, who is on this risk of getting skin cancer? Fair and light skin color. People they have greater chance of having skin cancer. People who are exposed to chemical, to ultra ultra ultraviolet light, people who are older age, and men, because men spend more time outside, they are more likely to have they are more a risk to have skin cancer. So those are people who are a risk. And the sign, I'm going to give you the sign. So next time on time, you know what to do, where to go, how to do it. These are signs of irregularity, skin irregularity. You need to know this. Watch out. Any spot or so that continue to itch, like it's itching right now, or it's hurting, or it's bleeding, watch out. You need to see a physician for that. There is some red flag. It's a red flag. An open sore that doesn't heal within 2 weeks. A skin with a skin with brown spot, you need to look at that. If the brown spot change the texture, if the brown spot increase in size and thickness, if it's irregular in outline and border, and if this brown spot appear after the age of 21, you need to watch this sign. It's really important. If you know this on time, you I think your treatment will be more effective. And for now, I think I gave you all the information you need to know about skin cancer. I told you you have your case is a squamous cell cancer. Is really treatable. We can treat this. We just have to explore and try to look at all the treatment, but we have to look your medical history, your age. I know you're 30. We have to look at your health condition too before choosing any treatment. So I'm going to give you some time to think about it, to think about the three what I told you: radiation, cryosurgery, photodynamic therapy. You need to look at it. I say radiation, X-ray beam are directed to the tumor with no need of cutting or anesthesia. The second one, cryosurgery, is as the physician destroy the tumor tissue by freezing it with liquid nitrogen. The third one is the photodynamic therapy, can be useful for growth on the face, on scalp. So these are three I mentioned. So you need to get a book, read different one. I say laser too, laser, yeah. Uh, you should look at the book, try to find out which one is more convenient for you. And me, I'm going to go trying to read if you had any cancer, any family disease, or anything before trying to choose which one. But I need you to have a full idea. Since this session is like it's not full session, go research, read the book, have full knowledge about skin cancer. It's treatable. We can cure this. You just need to know this on time, and you just need to avoid this by avoiding sunlight, applying sunscreen, and watch out your body. Watch out all the red flag. I mentioned to you, sign of skin irregularity. Watch out. So I think it's going to be fine. We're going to go over this. I'll see you tomorrow, the same time, same place, and I think that's it. Do you have any questions? Um, okay, I'm going to give you the book and you're gonna read it. Thank you so much for coming, and I'll see you tomorrow. Thank you. That was a long session. I just talked to my patient, and um, I provide her some advice and education about skin cancer. Hopefully, she's going to watch out her skin. As I say, red flags, some irregularity on the skin, and she's going to prevent for future exposure, to avoid any future exposure of skin cancer. Thank you so